Welcome to my channel, Sunshine Shoulders. I'm Calvin. Thank you so much for stopping by today. The subject of my vlog today is the Delta variant is here in the Philippines. Can what happened in India happen in the Philippines? I want to welcome my new viewers and new subscribers. Your kindness, your generosity, your support of my channel has truly been amazing. I'll never take that for granted. A 58-year-old American who grew tired of the rat race decided to move to the Philippines in search of a new life. Well, I found that new life, and I want to share with you my boots on the ground experiences the only way I know how. It's by giving you the nitty-gritty, exactly what I'm seeing, what I'm living, what I'm experiencing. Never going to sugarcoat that. It's not going to start today. Yes, the Delta variant is here in the Philippines. According to the Department of Health, there's 47 confirmed cases. 23 are locally transmitted. 24 are from returning Filipinos from overseas. Raise your hand if you're tired of hearing about the COVID. You know, I'm not afraid of the COVID, but I'm afraid of what goes along with the COVID. The restrictions and lockdowns, the deaths, the economic disaster that accompanies COVID. I'm walking into what I call the Enchanted Forest here in Center Mall. According to the CDC, the Centers for Disease Control, the Delta variant is 40 to 60% more contagious than the Alpha variant, which, by the way, is 50% more contagious than the original strain. And I asked the question about India because there's so many parallels between the Philippines and India. Number one, the congestion. This is one thing that plagued India when the variant hit that country. In and around the Philippines, there's a lot of congestion, especially in these urban cities, these squatter areas. And that poses a threat by being so transmissible. Once it hits, it's going to be impossible for people to escape it. The second parallel is the slow and methodical vaccine rollout. Now remember, I'm not being critical of the government because the Western countries, let's face it guys, they bought up all the vaccines. Okay, there's not enough to go around the rest of the world, really. I mean, it hasn't been an equal distribution of the vaccines, of what one U.S. doctor calls the magic bullet. Says the vaccines are safe, effective, and they work, but it hasn't been an equal distribution. So countries like the Philippines, they've fallen behind. And when you get a virus that's as transmissible as this Delta variant, it's going to cause some problems, man. And then the complacency. It just doesn't seem like there's a sense of urgency. Even though right now, today, which is Saturday, July 24th, President Duterte has called an emergency meeting of the IATF, the governing body of the fight against COVID. He's called an emergency meeting today to discuss how to control the spread. And, you know, it includes closing the borders of the country again. They've already banned 8 countries, and then they added 2 more to it recently, yesterday, Malaysia and Thailand. There just doesn't seem to be a sense of urgency. And see, one thing about Filipinos, they're probably great poker players because they wear this poker face. You don't know if they've hit the lottery or the house is on fire. The expression just never changes. And let me give you some context of what actually happened in India, if you didn't know. See, what a lot of people fail to realize is back in February and March, India was, quote unquote normal. I mean, it was humming along really. And according to reports, the major city, the capital city of Delhi, was approaching herd immunity. I mean, so, spirits was high. It looked as if India had beaten, the COVID. That's on one side. Of course, what comes with that sense of, that false sense of confidence is the complacency. Mask wearing and social distancing went out the window, which is what I see a lot here. That's on one side. Of course, the mass gatherings, which, makes the variant, it just creates an environment for the spread of the disease. But that's on one side. The other side, you've got these doctors and scientists who are screaming at the top of their lungs, hey, we're not finished yet. We're not done. One slip up, once these variants start, and it could be a disaster. And see, that's exactly what happened. The doctor went on record as saying, I wish I was wrong. But it wasn't. And according to this article that I'll put in the link, the numbers skyrocketed. It went from 100,000 cases a day in India, which has, about 1.2 billion people, to 400,000 a day. But experts caution you about those numbers. They say, hey, that's an undercount, grossly undercounted, because the testing centers, the hospitals, the crematoriums were overwhelmed. They was overfilled to capacity. You couldn't get a real number about how many people were really affected. But according to this, it spread like a tsunami wave. And of course, came the deaths. According to one U.S. doctor, the variant, the Delta variant, is so transmissible that the families over there could not escape it. Whole families were affected. It got so bad over there that they were telling, the government was urging the citizens to wear 2 masks. Not 1, but 2, and to keep their doors and windows in their houses open to maximize ventilation. And see, man, I'm gonna tell you something. That scares me, because that could easily be talking about the Philippines and what's happening. Unless they act swiftly, precisely, we're gonna have another India on our hands, man. I'm boots on the ground. I'm telling you what I'm seeing, what I'm living, what I'm experiencing, man. There's a lot of complacency going on. The congestion here in some places. There's 47 cases, 3 deaths. They haven't gotten the full numbers of the vaccinated and unvaccinated, but right now, they know for sure that 18 of the 47 cases are unvaccinated. See, and that's another scary thing. See, the vaccines, they just recently received a big shipment from Pfizer. I believe it was 40 million doses, so that's going to be 20 million people. But is it too little, too late? Another lockdown here, man, I tell you what, it's going to send things spiraling. And remember, Filipinos, according to one of their government officials, he's actually the head of the IATF, he said, look, we got to get our heads out of the sand and stop pretending like things are okay all the time. And see, that's the view you'll get over here. You'll think like everything's okay, man. These lockdowns have devastated this economy. And I see the horrors, man. They're all around me, man. And I would hate to think that this Delta variant will get a foothold in here, and you're talking about millions of hospitalizations, millions of deaths. I'm not panicking, man. I'm not over exaggerating things, man. Just go look what happened to India. And the Philippines has so much in common with India. The two major things, again, the congestion and the lack of vaccines and the slow, methodical vaccine rollout. Those two things could create the perfect storm for a catastrophe over here. Then here comes the lockdowns on top of that. Right now, Resolution 125 that allowed children 5 to 17 to come outside, it's been suspended. They cannot come outside anymore. And I'm afraid that coming out of that meeting today, that emergency meeting, they may lock this place down totally. Because really that's the only way to fight the spread, to prevent the spread, is to lock it down. But if it's so transmissible that you can't escape it, you know, what can you really do over here? What can we do? Especially when there's no vaccines. So I'm worried. I'm not afraid of the COVID. I'm afraid of what comes along with the COVID. The economic disaster, the restrictions and lockdowns, the deaths, you know, the suffering, you know, of the population, man. And it's right at the doorstep, man. I don't care what nobody tells you. I'm a vlogger over here, man, and when something like that comes across my feed, I gotta talk about it. You know, right or wrong, and I don't, you know, want to hear from you anti-vaxxers and you COVID conspirators, man. This is a life and death situation we're dealing with here. And unless they get on this and act swiftly and precisely, we're going to have trouble on our hands over here, guys. You know, you heard it from me first. I just hope I'm wrong on this one, because this country has suffered enough under COVID. And again, raise your hand if you're tired of hearing about COVID. I am, but until we can get the vaccines, until we can reach the herd immunity, until we can get equal distribution of these vaccines around the world. Because see, that's the problem. I was talking to a friend of mine in America. She hasn't taken the vaccine. Okay, she's a Filipina. She hasn't taken the vaccine. Listening to the locals over there, and of course, the superstitions over here. And I told her, I said, look, don't be stupid. I said, don't listen to people on Facebook. Listen to the scientists and the doctors. Err on the side of caution. There's an article on Yahoo right now, but Yahoo draws their news from other outlets, that patients are on their deathbeds. They're dying from COVID. They're begging the doctors for the vaccines. It's too late. You know, don't wait until it's too late. I told her to take that vaccine. I said, you got children. You got a family over here that cares about you. Don't be stupid. I mean, if you're going to err on the side of caution, err on the side of science. They say it's safe, it's effective, and it works. And unless we get all of that working on our behalf over here in the Philippines, we're headed for trouble. This Delta variant is here. And I asked the question, can what happened in India happen here? Absolutely. We're on the threshold of that. There's no vaccines over here, ladies and gentlemen. It's congested over here. There's been a lot of complacency. Doesn't seem like any sense of urgency. Filipinos wear that poker face. You don't know if the house is on fire, if they hit the lottery. So thank you for stopping by today. I really appreciate it. I wanted to just kind of talk about that. You know, I'm sick of COVID. It's gone beyond pandemic fatigue with me. You know, I'm just hoping that we can get back to some form of normalcy, because the horrors of the pandemic are all around me, man. I see it. And I just have so much love and compassion for this place that it breaks my heart, man. But, you know, there's only so much that a 58-year-old black man from America can do over here, man. But I can't talk about it. I just want to let y'all know that we're on the threshold of a potential disaster, man. And we'll know more about it as they come out of that meeting today. But I'm almost sure they're going to lock this place down because they have no other recourse. There's no vaccines, or not enough vaccines. And if this thing gets out of hand over here, man, we're going to see deaths that this country's never experienced before. So thank you so much for stopping by. If you're in America, it's getting late. Please help somebody before you let your head hit the pillow. But if you're on one of them late grocery runs, beer runs, weed runs, just getting off second shift, or you're on your lunch break, and you see somebody in the street, buy them something to eat, buy them something to drink, give them a few dollars. If you're in the Philippines, it's about 7:30 a.m. Look at those beautiful mountains in the back. Remember, I tell you that St. Carlos City is surrounded by some of the most beautiful mountain ranges. I want to show you something. In all of the Philippines, maybe the world. It's early. There's no excuse why we can't go out and intentionally help somebody. You don't have to give them money, man. Give them something to eat. Give them something to drink. Listen to their problems. Give them a shoulder to cry on. Because if I don't know anything else, I know this one thing for sure, that when we help other people, we help ourselves. Take care, stay safe, stay COVID free. I'll see you next time. Look at this view over here. I mean, it's just got this 3D view to it. I wish I could give you a better view, but you know, my iPhone just won't reach that far. But take care, everybody. Let's hope that we can beat this COVID. We can hold off the onslaught of this Delta variant, guys. Take care.